Today we're going to talk about pain. We all experience pain to varying degrees. Some people experience more intense pain than others. And in this video, we're going to go into the mechanisms behind pain, why that is that some people experience more intense pain or have more persisting pain, and of course, treatment strategies to add to your toolkit to ensure that the next time you experience a situation that causes pain, you can get out of pain in less time, and the overall experience, the pain will be less intense. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel, we talk about anything and everything related to health, mobility, fitness, mindset, with the end goal of empowering you with as many tools as possible to live an overall healthier, happier, more active life. And all that being said, we are going to tackle this very complicated topic of pain. Now, before I dive into the content of this video is sponsored by CareX. When we get to the intervention component of this video, one of their products is really helpful with pain. It's a TENS unit, and I'll get into more of what a TENS unit does exactly. They were gracious enough to sponsor this video, so thank you to CareX. So first, we're going to start big picture. Pain, big picture, is an unpleasant sensory or emotional experience that's usually brought on by either perceived or actual tissue damage. Pain can kind of be divided up into two kind of big picture categories. This is the zoomed out 10,000 foot view down into acute pain and chronic pain. Acute pain is usually pain that with a sudden onset and usually has an identifiable cause, such as a surgery, a torn ligament, a burn, a tear, broken bones, or some type of a tissue injury. Now, when we say acute pain, we're usually talking about pain that resolves within 6 months, meaning that we identified the cause and within 6 months, you will be able to return to your normal activities. Then there's chronic or persistent pain. And chronic or persistent pain is any pain that lasts greater than 6 months. Chronic pain can have an identifiable cause, but there are some people who experience persistent or chronic pain where there is no identifiable cause. Some common conditions that are associated with chronic pain are headaches, arthritis, some cancers, nerve injuries, back injuries, and fibromyalgia. Chronic pain can also cause emotional problems such as anger, sadness, depression, anxiety, and fear of re-injury. So the reason I explain those two definitions is because whether you are currently in pain or not, the goal of this video is for you to get really, really good at implementing the appropriate tools when you do experience pain, because again, we all are going to experience pain at some point. We cannot avoid tissue damage 100%. So we're all going to experience it at some point. The goal of this video is to tackle it while it's in the acute phase and hopefully prevent that laundry list of things I went over in that persistent pain category, prevent acute pain from turning into chronic or persistent pain. So as I mentioned earlier, everyone experiences pain to varying degrees, and depending how you or your body and your brain perceive pain depends on a variety of factors. These are biological factors, psychological factors, and social factors. So some of the biological factors that influence the severity and the intensity of our perception of pain. One is the actual severity of the tissue damage. The other one is this a re-injury? Have you previously injured that same area? That can influence the perception or the severity of pain. Illness or disease, diabetes impacts the nerves associated with pain. So someone that has diabetes might have more intense pain. There are neurologic factors that influence pain severity. So if there's an area of the brain that's damaged that interprets pain, that can also impact the severity of that pain perception. There are some genetic factors that can influence pain perception as well. Hormone imbalance can also influence pain perception. There is some association with low thyroid levels and joint stiffness and pain. So that's another biological factor that might impact someone's perception of pain or the intensity of pain, and obesity. And the reason that obesity can make pain more intense is that adipose tissue, in particular, adipose tissue or fat cells around the organs. So if you're someone that kind of has that apple shape and you have a lot of extra or visceral fat or a lot of adipose tissue around your belly area, adipose tissue releases chemicals that activate our innate immune response. So our innate immune response is kind of like the body's first layer of defense. In normal circumstances, it's intended to be the first layer of defense for any foreign invaders, such as a virus or any new tissue damage. This process is kind of triggered, for those that are a little bit more nerdy, this process is triggered by interleukin 6. Interleukin 6 is kind of a precursor, or is what activates the inflammatory response. So for those of you, if you've ever broken a bone or bumped your arm, you notice it swells up almost immediately. That is part of that innate immune response. So it sends more blood to the area, and it also releases more chemicals. Part of those chemicals, or some of those chemicals, are actual chemicals that cause pain. So again, adipose tissue increase fat cells around the abdominal region, releases this interleukin 6, which is a precursor or something that activates the inflammatory process. Part of that inflammatory process includes a chemical or chemicals that also cause pain. Now again, that is extremely simplified. I do plan on doing more videos in the future about this whole inflammatory process, because it really is critical for brain healing, but also you understanding the importance of this inflammatory process to help you further understand some of the steps that you can take, not just in dealing with pain, but also in your stroke recovery if you do have a neurologic condition, or just overall brain health. So that is a very simplified explanation of how obesity can kind of cascade down and contribute to the severity of pain that you might be experiencing. So those were the biological factors. Some of the psychological factors that impact pain are mood or stress. That inflammatory process that I talked about when it comes to obesity, those same chemicals are also released when we are stressed. So that's kind of same cascade of events can happen if you are stressed. Coping strategies is another kind of psychological factor that can impact our perception of pain, and also previous trauma can also impact how our brain perceives pain. So now we've gone over the biological factors, we've gone over the psychological factors, and then there are also social factors that impact our body's perception of pain. Social factors include access to healthcare, whether or not we have a spiritual practice. People that engage regularly in a spiritual practice usually have better coping strategies. Better coping strategies yield potentially less severe pain and decrease the duration of pain. Social support and ethnicity also seem to play a role in how someone perceives pain. Also education, so the more you understand your condition and what's going on the inside of your body, and that can also impact how your brain perceives pain and how you cope with pain. And then also stigma. So total side note tangent, really not anything to do with pain, but I did have a patient recently who is here from another country. This person has had a stroke, and her doctor back in her home country, every time she goes for a follow-up visit, just reiterates that she's lazy, and that's why she had her stroke, and that's why she can't move. And that can really impact how we are able to cope with pain. If you're constantly being put down or told that you are lazy or anything to that degree, that can definitely negatively impact how your body is able to cope with pain or decrease the severity of pain. So now that we kind of understand what pain is, the factors that influence pain, hopefully by now you understand that pain is extremely complicated, and anyone who tries to reduce your pain down to a specific location or a specific injury and kind of writes you off, they don't understand this model of how many factors influence how someone perceives pain. But again, it's very complicated, and every person should be approached individually when coming up with a treatment plan. So what exactly is the treatment plan? And again, remember, even if you're not in pain right now, the whole goal of this video is to ensure that every single time you have pain, you have less severe pain and you have less of a duration of that unpleasant experience. So the treatments that we're going to go over today include physical, cognitive, and pharmacologic. So let's go ahead and start with kind of the physical interventions. At the top of the list, whenever you're in acute pain, ice, compression, and elevation. The other things that you can do are stretching. Stretching definitely helps. It increases your body's tolerance to movement. Sometimes our tissues, after even just a minor injury, they become less tolerant of stretching or lengthening. So when you move, it hurts. So stretching is also very important. Movement in general helps with pain. Now, remember I talked about that immune response earlier. That really has multiple factors. That inflammatory response just wreaks havoc on our body, and we don't want that process going on and just fluid just sitting in between our cells. You want that fluid moving. You want your system kind of moving that fluid out. So move. I still have patients that were told 20 years ago that the first thing you're supposed to do after a back injury is to lay down for 3 weeks. Well, we have 1000%, the medical establishment has found that to be the absolute worst advice. The last thing you want to do if you have hurt your back after there's no serious injury, such as a fracture, you want to move. And kind of bringing it back to the sponsor of this video, TENS. TENS is an extremely beneficial modality when used in conjunction with several of these interventions. But TENS are pads that you put on your body, and a little machine delivers an electrical current and stimulates a sensory nerve that the brain possibly perceives as non-threatening, and therefore focuses less attention on what the brain may have considered as threatening. It's extremely effective in helping acute pain and prevent it from turning into chronic pain. If you have chronic pain, it is helpful in just getting you to block that signal temporarily so that you can move and do some of these other physical interventions that we're going over right now. So definitely TENS. Heat and cold. We've already talked about cold, but heat's also something that can help with pain. And a contrast bath where you alternate between hot and cold. Alternating between hot and cold helps with circulation. So that is called a contrast bath where you alternate between hot and cold. Acupuncture also has some evidence that it helps with pain. There are some topical creams that can also help with pain. Massage is another intervention that could potentially help with pain. In most cases, probably just because it decreases your overall stress and just allows your muscles to relax a little bit. So those were kind of the physical factors. Now we're going to go into the cognitive interventions. Now, I am a physical therapist. Obviously, we focus on more of the physical interventions in decreasing someone's pain or addressing acute pain and preventing acute pain from turning into chronic pain, and also helping people with chronic pain. But I am biased towards those physical interventions that I just went over. But I do think it's really important to talk about these other interventions just so you know that it's really needs to include all three of these areas. So the cognitive component of this just is based on the understanding that our thoughts and our feelings and our behaviors kind of all link up together. So when it comes to pain, what you think about the pain and what you feel about the pain will guide your behaviors. And the goal of the cognitive interventions is that your thoughts and your feelings are positively aligned with positive behaviors that are helping to move you out of pain. When there's a misalignment, which is oftentimes what happens, meaning that your thoughts about the pain and your feelings about the pain are kind of dysfunctional, they will also lead to kind of dysfunctional behaviors that will throw you into this persistent pain cycle. So one therapy or intervention that has been proven to be very effective is cognitive behavioral therapy, or CBT. So CBT focuses on coping skills that target the unhelpful thoughts, feelings, and behaviors related to your unpleasant experience or related to your pain. So first, let's talk about thoughts about pain. So some common thoughts that you might have about pain is that this pain is always going to be here. It's never going to go away. This pain is going to kill me. This pain is damaging my tissues. I am disabled because of this pain. I'm always going to be disabled. There's nothing I can do to help myself get out of this pain. So those are kind of unhelpful thoughts regarding pain. And again, remember, this is in the presence of actual tissue damage, or in some cases, even not in the presence of actual tissue damage. And then those thoughts lead to certain behaviors that are associated with those unhelpful thoughts or that are created by those unhelpful thoughts. Some of those include just staying in bed, not engaging with family and friends, not moving out of fear that pain is going to get worse, holding your arm or your neck. So if you're someone that gets tension headaches, holding your head all the time, that is an unhelpful behavior that kind of reinforces unhelpful thoughts and feelings. So that's another kind of a pain behavior. Frowning, grimacing, excessive sleeping, and taking more medication than prescribed. So again, just to kind of keep us all on the same page, right now we went over the physical interventions for pain, very, very, very important. Now we're kind of going over one type of way to address the thought patterns associated with pain, equally as important as those physical interventions. You have to first accept that you're in pain. That's extremely important. Accept that you do have control over your pain, also extremely important. And then once you've done that, this cognitive behavioral therapy will really help you to get to the unhelpful thought patterns that are leading to unhelpful behaviors, unravel that a little bit and replace that with more helpful thought patterns, things that you are capable, you do have control over your pain. There are things that you can do to help yourself. You're not damaging tissues. You're not, every time you move, your pain is not going to increase. Those are kind of more helpful thoughts. Actually, moving helps with pain, or it'll actually decrease your pain over time. Those would be more helpful thoughts to kind of put in that place. And then once you do that, kind of replacing some of those negative behaviors that are contributing to pain and replacing those with more positive behaviors. So now that you've removed the fear of pain because you've addressed these thoughts, it will yield helpful behaviors that will further get you out of what we call this pain cycle. So cognitive behavioral therapies, identifying the unhelpful thought patterns, identifying the unhelpful behaviors, holding an arm, grimacing, frowning, coddling your head, trying to remove or replace some of those behaviors which could be contributing to you staying in this pain cycle. So one other thing I want to say about that's kind of relevant to the CBT, but remember when I talked about the factors that increase pain, and I talked about education being one component that can negatively influence pain or can make pain worse? Not being educated or not fully understanding what's going on inside of your body is one thing that can make pain worse. So that's one of those social factors, that education component. So when we get to this CBT, this is kind of where that will insert in. So if you can gain more knowledge, information, talk to your doctor about why you're in pain and strategies or things that you can do to get yourself out of pain, that is also kind of going to fit into this cognitive behavioral therapy model, is giving you more agency, giving you more control by being educated and aware of what's causing your pain, what is actually injured in your body. If you've recently had surgery, before I even went into surgery, to prevent acute pain from surgery from turning into chronic pain, if it were me, I would spend probably an entire day on my computer understanding everything I needed to know about that area of my body, that surgery. I would talk to the doctor or the PA about what exactly to expect during surgery, immediately following surgery, and in the days and the weeks after surgery. So if your pain's not getting better, that's again where I would go to the doctor, ask why your pain's not getting better. Maybe there's more insight you could gain. Maybe he could tell you your surgery was more complicated, or you were under a little bit longer, or, if he could give you more information that would ease that fear that you're not abnormal or there's nothing going on that's damaging. He would actually give you a rationale that makes sense about why you're still in pain, that can also get those positive thoughts to align with more positive behaviors just by you being educated and knowledgeable about what's going on inside your body. So I hope that kind of makes sense. I've had patients recently where they're a little bit resistant to talking about this area of the thinking and the feelings behind pain or that contribute to pain. And basically what I said to this person was, you don't have to go to a shrink. You can look this stuff up online. Look up thoughts that make pain worse. You can probably Google something as simple as that, behaviors that make pain worse, and kind of identify maybe some things that you're thinking or feeling or behaviors that might be contributing to your pain, and start replacing those with more helpful behaviors. And then the last component of this treatment model, so we've got physical, we've got cognitive, is medication. Now, again, I told you I'm biased towards the physical things that you can do. I am not a medical doctor, so I'm just going to give you like a brief overview that yes, medication can sometimes be helpful when it comes to pain, but it's important to understand that in most cases, most people want to jump directly to medication because it's the quick fix. But in all circumstances, medication is a Band-Aid. So even it's helpful. It's a helpful Band-Aid because if it can help you to move, and then moving can kind of get you out of that pain cycle. I'm not saying it's bad, but I just want everyone to be aware that there is a downside to every medication. And then within medications, there's over-the-counter medications, which are Tylenol or acetaminophen and aspirin or NSAIDs. Tylenol, the downside is it can damage your liver. NSAIDs, when taken for prolonged periods of time, can cause stomach ulcers. So even stuff that's over the counter that doesn't seem like harmful and it's not a narcotic, there are downsides to that. So those are kind of the over the counter medications. There's also creams that work extremely well. And there's also lidocaine patches or that you can buy now over the counter. So all of those, they're helpful, and the lidocaine patch probably doesn't really have any side effects, but those are the over-the-counter kind of medications that you can use to help with pain. Now, on the prescribed medication side, there's a lot of different medications that you might be prescribed for pain. Sometimes antidepressants are used in helping with pain. And as I've said, with every medication, there are downsides. So some of the side effects of antidepressant medications are dry mouth, blurred vision, constipation, weight gain, and sexual problems. The next kind of category are anticonvulsants or anti-seizure drugs. These are very common in the neuro world, and one of the reasons is because it's believed, they don't really know for sure how these medications work. And I did look at several studies. Again, I'm not a doctor, but it doesn't seem like there's really a strong rationale or theory behind why these medications work, but they are commonly prescribed for neuropathic pain. Gabapentin is one, Lyrica is one, Dilantin is another one. And again, these all fall in this area of anticonvulsant or anti-seizure medications. But some of the side effects of these anti-seizure or anticonvulsant medications include headache, confusion, skin rash, nausea, vomiting, loss of appetite, and weight gain. The next group of medications are opioids. It appears from, again, just what I see from patients that I work with. They're definitely not as common. And then the other medication is tramadol. Tramadol is an opioid agonist. So in my area of the country, in Florida, this medication is extremely common, and there are side effects. The biggest side effect I see is drowsiness, lightheadedness, weakness. Those are the downsides. Again, it's not a medication that you want to stop without talking to your doctor, but just so you're aware, if you are on this medication and you don't really know why you're on it, or your doctor doesn't really discuss it when you go to your follow-up appointments about whether or not you can start tapering or changing the dose or anything like that, those would just be conversations that I would have with your doctor. Again, I can't stress it enough. I'm not a medical doctor, and I'm not giving you advice on what to do regarding medications. That is a conversation to have with your doctor. I am just kind of highlighting some things so that you know that it might be a potential area that you want to address with your physician. So again, just to recap, this whole video was talking about acute pain, how to stop acute pain from turning into chronic pain, or if you are someone that's active and you're prone to getting injured, how to decrease the intensity of your pain and the duration of your pain by understanding that there are 3 factors that kind of influence how we perceive pain. Those are biological factors, social factors, and psychological factors, and they all contribute to that pain severity. When it comes to treatment, it really is kind of a multimodal approach, meaning that you do need to address the physical interventions that you can, the cognitive or the thinking side about pain and how you perceive pain, or your thoughts and your feelings that come up when you are experiencing this unpleasant sensory experience. And then, of course, the third kind of prong is that medication. Again, just to reiterate, this video is sponsored by CareX, and I will put a link for their TENS unit in the description below. I'm super grateful that they have offered to sponsor this video, so huge shout out to them. I want to keep putting out free information to give all of you as many tools as possible to take ownership of your health, and by having sponsors, it really does help me to continue on this mission of being able to provide these videos for free. So thanks again to CareX. If you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button. Turn on that notification bell so that you'll get notified every time I upload new videos. If you have questions, don't forget, for $5 a month, you can join us in our monthly lives. Link for that is in the description below. You get a form prior to the live event where you can submit questions, and then we meet via a Zoom room where I will answer your questions. So it's a lot of fun. I get a lot of great questions. You'll learn a lot just from other people's questions. So link for that is in the description. And again, it's only $5. If you want a little bit more, you can join our Gold Monthly program where you will have access to over 300 exercises to help improve the quality of your movement, help with pain. There's stretches in there. There's ways to get active regardless of where you're at in the recovery process or what your mobility is at. We have exercises from bed bound, so those of you that aren't even getting out of bed, exercises in there if you're still sitting and you're not yet standing and walking. And then, of course, if you're standing and walking, ways to advance to more higher level activities. So link for that to join that membership and get access to those exercises also in the description below. I enjoyed spending time with you all today, and I will see you in the next video. You guys have a good day.